My name is Christopher Granger-Bell, and this is my project on the lateral sinus. I greeted the patient upon her arrival. When she stepped in the imaging room, I verified the patient's information, her name, and her date of birth. I asked her which part of her body was causing her trouble. She told me that the right side of her face was in pain. I verified with her physician via email that the x-ray that he wanted was the lateral sinus. The IR was 10 by 12. The IR orientation was portrait. The IR location was the wall bucky. The SID was 40 inches. Patient position, upright. Part position, right side of the face pressed against the wall bucky. CR location was 40 inches from the patient to the point midway between the outer canthus and EAM. There was no angulation of the tube for this exam. I collimated the beam to the four sides of the anatomy in question. The visual appropriate marker was on the upper right side of the IR. The KVP range was 75 to 85. The instructions for the patient was suspended respiration on expiration. The anatomy demonstrated was all four paranasal sinus groups. Items in profile: orbital roofs, greater wings of the sphenoid, celica turcica, sphenoid sinus, frontal sinus, ethmoid sinus, maxillary sinus, rami of the mandible. The pathology best demonstrated was the air fluid levels in the sinus, fractures inside the sinus, and any lateral fractures of C1 and C2. The end.